Okay, so I'm going to show a few foot and ankle techniques. All of these were pulled from the Cook and Maitland text and will be cited in the comments. So go ahead and bend this leg. We'll start with the tailor curl distraction, and I like to have the opposite leg bent to provide a little bit of counter force with, so you don't pull the patient, slide them down the table. Grabbing the affected leg, I like to interlock fingers around the talus at the top with thumbs on the bottom, just to give me a lot of control over the foot. This table will slide on my kitchen floor, so I'm going to stabilize it with my knee, but normally I wouldn't do that. Pull into neutral or closer to a little bit of dorsiflexion, and I will lean back here. Just a straight distraction force. If I want to give a manipulation, I'll make sure I get a little hold there, and then a quick pull. In real life, I will be able to use my body a bit more than this. And then in PT school, we actually learned to add a little bit of an eversion, range of motion to the hold at the top, so that when you give a pull, it's a little bit more locked out. Okay, so that's the manipulation. We can follow that with the dorsiflexion, mobilization, and movement. So you can go ahead and step down. Yes, so place your right foot here. Okay, and then we'll instruct the patient so they can do this at home to use one hand to dorsiflex the toes and place their hand underneath the first toes. And the second, if they need it, backhand will make sure that that heel stays down, touching the floor, and doesn't lift up while they shift their weight forward and back. If they're unable to keep good mechanics during this, I'll say, okay, go ahead and lose your grip, stand up. I can provide this force as you lean forward and lean back. Or I like to use a half foam roll to put underneath there so it'll hold the toes up, and I can just provide the force to the heel to keep it down on the ground. Okay, and then go ahead, let's pull this back there and lay on your back. You can also do a dorsiflexion mob similarly. We'll just do this foot. And you can, if you have a wedge or half foam roll, I'll just use my leg, can prop the foot up here and provide an AP force there to the talar dome to get a little bit of a added kick into an AP. If not, if they can't tolerate that, of course we can do this just in supine lying, stabilizing calcaneus here and pressing straight down on the talus there into a dorsiflexion movement. Let's see, go ahead and turn onto your stomach. So we can also do a tailor curl A to P mobilization. In prone with the knee flexed, and we're gonna do just really similar and hold, and this is more of a counter pressure here. So holding calcaneus with the backhand, and then mobilizing hand is on the talar dome, and this is just pressing in and out there, that way. We can easily just flip that the other way and provide the opposite force. So stabilizing higher at the tibia and fibula and mobilizing, making sure we come superior to the calcaneus onto the talus, not just mobilizing the calcaneus. Coming here and doing a PA also in this position. This can also just be done in prone with like a towel. Just this way, if you had a towel or a good wedge, really a wedge is best. Here, pressing straight down there as well into the plantar flexion motion, sorry. Okay, and then while we're already here, I can go ahead and do subtalar movements. So I'll come from the top of the foot here, and we're gonna stabilize. We'll just do medial and lateral glides. So for this one, I will stabilize on the fibula and the lateral talus, and we're providing a medial subtalar glide. This hand is on calcaneus. Again, going straight, back and forth, pressure, counter pressure here, and I can use my body to hold in different angles of plantar flexion and dorsiflexion, depending on where I want to get that joint mob. And then just switch to do the medial glide, stabilizing at the tibia and medial talus, pressing on the lateral calcaneus to the side there, and getting that subtalar medial glide. We can also do that same mobilization in side lying, so face that way. And it'll just be top or bottom leg. So if we start with the top leg here. Okay, I don't have a high-low mat, so in the clinic I would raise this, but we're stabilizing under the leg here. So I've got tibia and medial talus stabilized, and then we scoot down a little bit. Yeah, and then I can give the medial glide to the calcaneus there. Then can just have them turn over for same leg. Actually, I'll come here. Stabilize fibula and lateral talus there, and then be able to press into a lateral subtalar glide here. And those are all the ones that are included in the Maitland and Cook book for talar curl APPA distraction, dorsiflexion, mobilization with movement, and subtalar lateral medial glides.